Some other news now. The U.S. leads the world right now when it comes to the number of confirmed monkeypox cases. According to the CDC, as of Friday, there are now more than 5,000 cases in 47 states. Cases have also been reported in Washington, D.C. and Puerto Rico. Meantime, New York, they have the most cases, followed by California and then the state of Illinois.
Joining us now is infectious disease specialist Dr. Amish Adalja and also senior scholar from Johns Hopkins. Dr. Adalja, thank you so much for joining us once again. I spoke with you yesterday about this very topic. So before we get to the monkeypox outbreak, though, quickly, just want to get your take once again on President Biden's COVID rebound that we discussed. Of course, doctors saying it's a rare rebound case after taking the antiviral drug Paxlovid. Have we gained any more insight into what it actually means to have this rebound infection?
No, I think that there's still a lot more questions than answers. We still have to understand how common it is, what the relationship with Paxlovid is, what the relationship with the person who's been infected is. But what we know is that these people do okay. They don't have any major setbacks when they get this rebound. So this shouldn't dissuade anybody from taking Paxlovid if they're in that high-risk group. And I think it really calls for a lot more urgency to understand the phenomenon and why it's occurring in this subset of the population.
And just to be clear, to reiterate a point that's been made now for the better part of 2 years, whether it's the vaccine or Paxlovid, the goal here is not to prevent you from getting COVID. The goal is to make sure that you don't get too sick or go to the hospital or die if you do get it, right?
Exactly. Our goal is to make COVID a much more manageable infection than it had been in the past. And that's what the vaccines, the boosters, the rapid tests, Paxlovid, the monoclonal antibodies all do. They shift the spectrum of illness to the milder side, like many other respiratory viruses, and that's a win.
So, Doctor, let me switch gears to the monkeypox issue right now. We have both New York and California, or San Francisco, declaring public health emergencies. They're debating it at the federal level, but they're not quite there just yet. 5,000 cases and counting so far. What is your concern right now about where we are, and is there really any potential here for this to get as bad or close to as bad as we saw in the early days of COVID?
There's no chance that monkeypox can become as bad as COVID-19. It's not a respiratory virus. You have to respect the fact that different viruses have different transmission characteristics and different trajectories. And monkeypox, to me, does not have pandemic potential the way a respiratory virus does. But what is concerning is that some of the mistakes that were made during COVID-19 are being made with monkeypox, such as flawed testing, vaccine snafus, lots of paperwork and bureaucracy, and maybe that's what these emergency declarations will help with, removing all that government red tape that's preventing the government from actually being responsive to the people on the ground. Monkeypox should have been a layup. It should have been very easy for the U.S. government to handle this post-COVID, especially after all the soul-searching about COVID. So it's very dismaying to see the government falter again, and I think it really calls for a lot of examination of how our government responds to infectious disease emergencies, and that it may need a complete wholesale revamp because it clearly is not working.
Yeah, that's a really good point. It should have been a layup. It should have been this moment where they're like, the infrastructure is in place, it's go time.
And lesson learned.
Right. But still, last week, federal officials did announce nearly 800,000 vaccines will be distributed across the U.S. Is it too late to stop the spread at this point, or will that make an impact? Will that make a dent in the continued spread outside of the groups that it's already spreading within?
The vaccine is the key to stopping the spread. And those 800,000 doses are going to be very useful if they get into the arms of the high-risk population very quickly. I don't think we'll see much spread outside of that high-risk group just because this virus is clearly taking advantage of a network effect in men who have sex with men, and we probably will not see sustained transmission outside of that group, although we will see some cases as we have in the recent past. But I think what the goal is to make sure that people who need that vaccine can get it and can get it easily, that they're not having websites crashing, that states and local health departments have transparency about how many doses they're going to get and when they're going to get them. If there's unpredictability, the state and local health departments can't actually set up these clinics. So the federal government needs to be very transparent about when things are coming. They shouldn't be hearing about them in press releases, which is what happened in New York City, where they heard about it in a press release from the senator rather than actually knowing it from subject matter expert to subject matter expert. It has to be managed much more competently than it has been in the past.
And to that exact point, obviously this is hitting the community of men who have sex with men harder, as you just pointed out, and that's about 1.6 million gay and bisexual men in the country. It's a 2-dose regimen, meaning, do we still have the doctor, by the way? We still have the doctor. Okay. So at 1.6 million gay and bisexual men in the country, it's a 2-dose regimen, meaning you need more than 3 million doses to be effective. According to the Washington Post, the U.S. is entering a critical 3-month period where cases may continue to multiply, but no more vaccines are set to arrive until October at the earliest. So once again, a situation where the virus is spreading much more quickly than the vaccine distribution. What's the root cause of that, meaning who deserves the blame for us seemingly botching this response with no lessons learned from COVID? And what does it mean in terms of the spread to have this vaccine be so delayed?
I think what we have to do is think about being innovative with what vaccine we do have. And if we prioritize single doses, the first dose, we will get headway against the virus. There's also an older smallpox vaccine called ACAM 2000 that is more reactogenic, but the military uses it, and some people can take that if they're willing to, and they don't have any of the contraindications or reasons not to take it because of the side effects that it causes. That's also something that should be on the table. The blame, I think, is all throughout government in the sense that those 800,000 doses, for example, they were sitting, some of them were sitting in Denmark and had not been allowed or approved for the U.S. because the FDA had never gotten around to inspecting that plant, even though we knew that those were going to be eventually approved. That kind of allegiance to bureaucracy and to that process in the face of an emergency, that's what's to blame. It's just people are not taking infectious diseases seriously. They are not being proactive. What we have is a reactive type of mindset in Washington and in state capitals. And that's not what a virus is going, that's not how you deal with a virus that's spreading between people. You have to be proactive. You have to be one step ahead of it and not worry about making sure you cross all the T's and dot all the I's.
And Doctor, real quick, though, obviously there's a lot to be examined here about the government response, but like most things, it also is an issue of personal behavior and personal choices. So what would your advice be to everyday people who are at risk for this particular virus?
If you're in the general public, this does not pose a major risk to you. It's not very contagious. It's not something that you get very casually. If you're in the group that's at risk, men who have sex with men, you should think about, until you're vaccinated, decreasing the number of sexual partners you have, exchanging information with your sexual partners to make contact tracing easier, because you have to recognize that monkeypox is spreading in this group, and it's going to be some time before protection is available in terms of the vaccine. So you have to think about reducing the harm the virus causes in your community by changing your behavior until we have enough vaccine.
All right, Dr. Amish Adalja from Johns Hopkins, thank you so much for joining us once again. Really appreciate your expertise on this.
Thank you.